Welcome back to the programme. Hospital waiting lists are one of the big issues facing the new government and the new Health Minister, Simon Harris. Now, new figures earlier this month showed the number of patients on public waiting lists has risen to more than 500,000 for the first time, while almost 24,000 people have been on outpatient waiting lists for more than 15 months. Susan Mitchell, health editor with Sunday Business Post, is here now. Why is it so bad, Susan, the waiting list problem?
Well, it's multifactorial. Initially, I suppose one of the biggest things is that we're ageing. As we age, as the population ages, we have more healthcare needs, so there's more demands on the system. But then there are huge capacity constraints within the system. An obvious example is hospital beds. Ireland has about 2.5 beds per 1,000 population, whereas the EU average is 5. So if you don't have enough beds, you can't actually get the throughput. It's not just hospital beds. We have difficulties recruiting and retaining hospital consultants. Last year, 1 in 4 posts that was advertised by HSE-run hospitals didn't attract a single suitable applicant. If you don't have enough doctors, again, you can't get the throughput. We have serious shortages of theatre nurses, which means that very many hospitals are being forced to have rolling theatre closures on a constant basis. So therefore, surgeons' operating lists are simply being axed on a continual basis. Okay. So this is all really creating additional pent-up demand.
So there are a number of breakdowns in the system, if you like, as you've outlined. Now, there are new targets in place, aren't there, to reduce waiting lists?
Well, there are various targets. I mean, the targets really have shifted like sand, to be honest, under the previous government. We've had targets like 15 months, 18 months, 8 months, 9 months. If you actually want to try and get a sense of the trend over the last number of years, the number of patients now waiting over 6 months for an elective inpatient or day case procedure has soared to 30,000. Back in 2011, when the previous government took office, it was in the order of 9,000. So those numbers have...
It's getting worse.
It is.
But look, a solution or a potential solution, or one that might work for some people, is this cross-border directive. Explain to us, if you will, how it would work.
That's right. This is this new EU directive that was fully commenced in Irish law last year. And what it entitles patients in Ireland to is to access care that they could or should be able to access in a timely fashion in Ireland, in any other EU country. And that includes private hospitals. And the HSE must foot the bill for that care. Now, the HSE will only foot the bill up to the amount that it would pay within the public system here. But the good news, in one sense, is that our public system is actually very costly. So people have been travelling to private hospitals in Paris, getting hip operations done, etc., and it's come in under budget. But you must cover the travel expense yourself, and you have to pay up front yourself, and then the HSE reimburses you. So obviously not everybody has 10,000 or 15,000 to actually pay for that procedure.
But if you have, it's a good way to do it, because you will get the money back.
It certainly is, and a lot of people are already beginning to avail of it.
OK, Susan Mitchell, thank you very much indeed for that.